Hello, everybody. This is Ron Bush with Ron Bush Consulting, and you're attending the Information Playground. I hope that you're listening to us on WVLP. That's WVLP FM. If you're in Valparaiso, Indiana, it's 103.1 on your FM dial. If you're streaming us, it's WVLP.org. They're a great little community station, and they do a lot in the community. I hope you visit their website, learn how to get involved. You can underwrite this program or any of the fine programming on WVLP. You can also find us, before I leave there, you can find us there Monday mornings from 8 to 9 a.m. and Friday afternoons from 1 to 2 p.m. You can also find us on demand on any of the podcast platforms that I'm familiar with: Spotify, Apple Podcast, Google Podcast, and 6 or 7 others, all under the Information Playground. And you can also find us on YouTube on the video side of things, also under the Information Playground. Ron Bush Consulting is a consultancy that helps businesses protect themselves against cybercrime. I hope you'll check us out at ronbushconsulting.com. My guest this morning is a very special guest, Dr. Rahul Gupta. Dr. Gupta, good morning to you. It's a pleasure to have you.
Good morning, Ron.
Thank you. Would you tell the listeners or the folks a little bit about yourself this morning and what you do?
Certainly. I am currently the Chief Medical Health Officer and Senior Vice President at March Dimes nationally. I'm a practicing internist with a background in public health. Prior to joining the March Dimes, I've served for 2 governors as the State Health Commissioner in West Virginia, and prior to that, I have been a local health commissioner as well as ran a private practice and taught medicine as well.
Wow. What a great legacy you have and all that you've accomplished. Let's talk a little bit about the March of Dimes. You know, I'm a Rotarian, and Rotary has a history with polio. We've been fighting it for the last 21 years now. March of Dimes got started that way.
Absolutely, Ron. And you know, it's a really rich legacy history. In fact, if people might remember that it was founded by a sitting president, and you know, we're 80 plus odd years old. We became most famous for helping fund the vaccine for polio, and then create and design clinical trials for polio, which you know, from Dr. Saul to getting on board, you know, one of the largest clinical trials to date, and doing it in a way that garnered the confidence of Americans, and really put us in the front seat of helping eliminate polio from this nation, as well as making a remarkable, with Rotarians, impact across the globe. So, you know, since then, we've been really proud to have the history where we actually have had such a positive impact on a killer disease. And then we've had, of course, you know, these partners in nation states, and then others like the Rotarians to help eliminate this terrible disease, you know, from the face of this earth. We have since then also focused on, you know, things like, you know, birth defects. What happens when, you know, whether it's folic acid or other aspects of it, preterm birth. So we've really used to taking on the toughest issues you can have, and then figuring out a solution for it. So now we are laser focused on ending the preventable maternal health crises, as well as the infant health crises, with a lens through equity. So that's kind of what we're in right now.
So if you would explain a couple of those terms, I guess narrow the focus or name it what it is where your focus is right now. Let's start there.
Sure.
When we talk about maternal, I'm sorry, would you say it again and then explain it?
Well, let me say it this way, Ron. Every 12 hours around the clock, a mom dies as a consequence of childbirth in this country. We are one of the few developed nations with this type of numbers. And that's why we call that maternal health crisis. So we have about 700 lives that are lost each year. But what's worse is that if you are a Black woman, your likelihood of dying is about 3 to 4 times higher than a white woman.
Wow.
Similarly, when it comes to infants, our preterm birth rate, which is, when you're born before that, magic time, we have 5 years in a row when the numbers are going up. They're so high right now, is that 1 in 10 babies that has been born in the United States is born preterm. And once again, if you are a expecting mother that is African American, your likelihood is 50% more of having a preterm birth child as opposed to a white mother. So there are some reasons that put us in as a very exclusive kind of exceptional situation in the United States. And that's why when we say our goal is to end some of this crisis, it's with a lens of equity, because we know we can't make any progress unless we start to make progress in terms of the inequities that exist.
Right. Lens of equity. I love that phrase. Now, do you attribute, we all know there's all kinds of limitations, inequalities in America. It's planet-wide. It isn't just America. But Americans like to focus on freedoms and liberties, and yet not everyone has it. I live in Arizona, a state that has a large Native American population. There are very few. When you look at Australia, their indigenous people didn't fare well either. You've got all kinds of I guess, illustrations. We think of Black Americans, I guess that's 1 in 5 experiences a preterm pregnancy. Is there, how can we start? This problem is just about as huge as I can think of.
It certainly is. And it does affect Native American folks as well. It affects Latinx community. Yeah. So it's a problem that we are seeing in communities all across, and there are some really good reasons that we can help eliminate. So one of the things we did was we created this report recently. We call it Maternity Care Desert Report. Just like food deserts, we looked at, okay, at the county level, where are these deserts that do not have an OBGYN, they do not have any hospital that's providing maternity care. And we found that almost half of the nation's counties, rural and urban, are areas where there's not sufficient care for people who become pregnant. So what does that really mean? That means that when you're living in an area and you don't have access to care, you're gonna have to drive somewhere. When you drive somewhere, then you're gonna have to take more time off from work. You're gonna have to find childcare. You're gonna have to arrange your day around to make that big trip. And then it's not inconceivable to think some people just decide to forego that oftentimes. And when you don't get good quality care during your prenatal period, of course, you might miss your vaccinations or shots. You might miss the ability to get enough and right medications to control your blood pressure or diabetes, or know what it's like to have healthy eating or exercise, and all that advice. And so we end up having poor outcomes, in part. So there's all these challenges we have in this nation that we have the ability to do a lot more. And that's where why we're fighting for the health of all moms and babies.
Yeah. Well, I'm so grateful for all that you do. It just seems such a tragedy in what we believe is the richest nation on the planet. There's a lot of our society, well, in a sense, 1 in 10 babies are preterm across the board. There's so much that we can do. We live in a time where medical technology just dwarfs any other time in our history. I'm usually on the negative side of this, talking about cybercrime, but when you talk about technology in medicine, Oh my goodness. It's just an amazing time. And yet in the nation that's the richest, our citizens don't experience that wealth. Not all are. I mean, there's always the 1% we can talk about. But
Yeah, I mean, we bring this up because we believe deeply that, the character of a nation is often judged by the way it treats its most vulnerable.
yes, sir.
And that includes people who are pregnant, babies. And that's where we're raising the flag, because this is something that has been time tested and proven that, we've got to start to make sure that people who get pregnant feel that they are part of a community. They're not discriminated against based on their race or their income or their background or their ability to access care or their education. So these things are very fundamental, and they're regardless of, in some ways, income. In fact, we've found some data where you typically think that if you have higher education, that's a protective factor against discrimination. It helps you get a better job. It helps you have a better life, generally speaking.
Mm-hmm.
But in terms of maternal health, we found that even if you had, a higher level of degree, your race still matters in terms of poor outcome.
Yeah.
So it's important. We believe that, this crisis, particularly of maternal infant health crisis, is something we need to be addressing more urgently. And it's only worsened, during the COVID pandemic.
Yeah. How do you start? What are you doing to move us forward?
I think, Ron, that's a great question, because one of the things we've done in the past, recently, we were able to push for some good policies that would help us move this nation forward. So there's a lot of good pieces of sort of both on the groundwork in terms of service, research, as well as policy change. We think pretty strongly that one of the things that would help us as a nation is to make sure that there's clear access to care. And that goes back to, we know that about half of the moms across this nation are giving basically birth and have Medicaid. So what we want to do is make sure that that access continues. And so expansion of Medicaid is one such strategies that allows more and more moms to be able to get coverage and plan that pregnancy, because about half of the pregnancies roughly in our nation are unplanned. The other aspect is oftentimes when you deliver about 6 weeks on Medicaid and you get kicked off of Medicaid. Now, think about it this way. If you have high blood pressure or diabetes or depression or substance use problem, it doesn't just magically disappear after 6 weeks. In fact, you're taking care of your baby and go through all the social pressures of being a new parent. You need it more than ever at that point. So we're really pushing for policies like extension of Medicaid to 12 months at least after delivery, postpartum, to make sure that those moms, along with the baby, is also taken care of, because it doesn't make sense for us to have a healthy baby and not have the mom alive with the baby, right, or in good shape. So that's the whole reason we're pushing this.
Wow. When we think about the disparity among the races in America, it isn't just as we look at this, although that's a huge part of it with maternal, they find my note here, maternal health crisis, but it's the disparity wounds our nation in many ways. And, it isn't just America. Again, it's around the planet, but speak a little bit, if you would, about inequality in America, racial harm and disparity. We're going to get back to public health and COVID, but I know you've written some on this and you've spoken about it.
I think what is important for us to think about overall as a nation is, I will use this pandemic as an example. What it has done is unveiled the inequities that already existed.
Yes.
So what do we see as a result? We see as a result a lot more frontline workers, a lot more people of color who've gotten sick from COVID, who have unfortunately died from COVID and been hospitalized in generally. So it's important that we think about policies that help support folks where they are today. It's unfair to have a pandemic and expect, people to choose between putting food on the table for their families and going out for a job and risk their health and their life. So it's clearly important that we have to do what we can to ensure that these, what we call structural determinants of health or social determinants of health, what it really means is if someone's living in a community, their ability to live, learn, worship, be raised, have the economic mobility, move forward, things like housing, things like transportation, simple things, food insecurity, these things become important. And we want to be able to give everybody the opportunity to excel. Oftentimes, and too often, it doesn't happen for folks. And those are the things that we think are critical. And, this maternal health and infant health is a part of that. I think it's more of a reflection of what's happening in America in terms of where we are as a nation than an exception.
Yeah, I think you're right. I do see somewhat of a turning point. I'm old enough to remember, and obviously I'm Caucasian, so I grew up in that those neighborhoods. I guess the way to say it. The idea used to be that you worked in the same place and you gave everything you had to where you worked. I remember my grandmother. We came up poor. I'm the first one to go to college. I managed to get to a master's degree in education, but I'm the first one in my family to accomplish any college degree.
Yeah.
And my grandmother used to say, when you're hired out to a man, I mean, country folks, that was the lingo back then. You do what he needs you to do. If you don't do what he tells you to do, then you're just stealing the money from him. You go somewhere else. That was the attitude.
Yeah.
Well, we don't think that way anymore. Companies owe us. I mean, we do owe them a decent day's work for a decent wage, but we don't owe them our lives. We don't owe them our families. We don't owe them our health. We don't owe, companies anything other than what they're paying us for, which is our skills and our abilities. The time used to be, I spent 25 years in Indiana, and the mills right up in Northwest Indiana. It was just common knowledge. Some days guys are going to get hurt, if they didn't have a pension, when I think of all the things the way it used to be, where you didn't have health care and you didn't have disability and you didn't have all the protections we have today, you just, I guess, went home and starved. I don't know. It should never have been that way, but at least we've progressed from there to where we are now. But we've got so much further to go. We really do. I loved your quote at the beginning. A nation is known by the way it treats its most vulnerable. I've used that quote hundreds of times. Can't remember who said it originally, but it's an excellent point, and it's true. How do we keep moving down this road? I know a lot of it is government policies. I know some of it is just helping organizations like March of Dimes that are leading the way here. Is there more that we can do?
Absolutely, Ron. I think your analogy is quite correct in the sense that, my kids grew up in coal country, and that applies there too. But, we learned we're better than that. We have now learned that there's so much more we can do. As human beings, we have a right. We have a right to, be able to have safe work atmosphere. We have a right to make sure that we get the ability to contribute positively to society. So we're just not quote unquote workers, but we are participants in an American experiment that has been far better than anywhere else in the world. And for that participants, we must be empowered. And some communities have not been able to be empowered, basically. And it's important that we do our part. So one of the things that we often see and experience is, if someone comes, as an example, to the front office, it's a real experience. And the person sitting in front office, would look at the person and say, honey, give me your driver license, check you in, and your Medicaid card. A judgmental statement, simple as that, it kind of tells the other person based on how they look, who they are, right? So we have learned to pass value judgments on people based on what they look like, who they are. And that's the part that we have to figure out how to get beyond that, how to learn, or rather I would say how to unlearn the learning. And it's going to take a while, but I think the national reckoning is happening as we speak, because we want to be a better nation. We want to be a nation that really does not discriminate, based on any of the factors we've talked about. And it's that nation that allows itself then to be, again, the champion of human rights. No longer it is just the military might, or no longer it is just the wealth. It has to be one that where it can only then stand up to other nations. Because, the situation that you mentioned, you work for the man and those things are alive and well in other countries, many other countries. And for us to make sure that we have a more, fairness and justice across the globe, we do have to start at home. And there's nothing wrong. There's nothing embarrassing about thinking that way. And I want us to think about that we shouldn't be embarrassed. Yeah. We should be thinking, okay, how do we get better? How do we improve? How do we unlearn some things? How do we make sure that we are training ourselves and our brains to not fall victims to these biases that already exist, to have biases to be human, first of all. So we shouldn't feel guilty, but what we should say to ourselves is we will stop judging people because, the way someone looks, the way someone talks, or the way someone dresses. So that goes back to not just race, but it also goes back to backgrounds. It goes back to people's, sexual orientation oftentimes is very important. So it's important, we often now we say pregnant people because we recognize and respect the ability and the technology we have now for a variety of people to become pregnant.
Yeah. Well said. Well said. I can remember hearing the phrase, you can't judge a book by its cover. And then the response to that is, well, sure you can. Publisher spent tons of money to tell you about the book on the cover. But we're not books. And some of us like to use, I'm a reader, I love to read. You see all these things behind me. But books tell stories. People have stories. They are stories. I think of in my job, my career, social engineering is a problem. Judging a person by the way they look is the best way I know to get conned. It's often considered an indicator that you can't trust someone if they won't hold eye contact with you. Well, what do you think con men do to start with? They practice eye contact because they know that's a dead giveaway. You won't trust them. It's getting beyond just the superficial presence of someone, their face, their color, how they're dressed. I've known people, we don't have time for it, but I've got story after story that just makes this point. You can't judge people just because of the way they look. There's more to us than the way we look. I'm born with this guy here. He's a little bigger than I probably would have chosen, but you know what? It's okay. It's just my nose. It doesn't matter. we really have very little to do with some things, but we have everything to do with the way we respond, uh, the way we think about others. So you know, I can have all kinds of things happen to me in life. The only thing I can do is respond, and that's the only thing I have any control over.
Yeah. Yeah. No, that's exactly right. And, as a physician, I've often seen, I've treated, let's say, kids. Oftentimes, sometimes they would have, conditions like sickle cell anemia, for example, and return back to the hospital, let's say every month, if not for the better, unfortunately.
Hmm.
And when these kids then, go on to high school and college, to me, that's a win. That's a win. They may not, that child may not be looked upon in high school or college. The child might be looked upon as a quote unquote low performer, but the adversity and the difficulty that child has had to prevail just to stay alive, much less to go through painful episodes and go through all the medications and hospitalizations that I, as a physician, and the family has endured. Nobody can see that. So sometimes you're right that it's not just who we are, but it's the story behind us, and we all have oftentimes different struggles. So it's not fair to judge. But it goes back to you mentioning that being the first in your family to go to college. I mean, wouldn't it be wonderful if we could have some way to see that more and more and more people are able to go to college for the first time. I think we would just have an amazing nation because we would know the value of education, and at the same time would have people in the workforce and leadership that look like the country, that look like the America. So that would be that's exactly what I think we all strive for.
I hope so. I believe you're right. I hope you're right. We're going to take a quick pause so I can identify how you can reach us and who and what you're listening to. I'm Ron Bush. I own Ron Bush Consulting, and we're a cybersecurity consultancy. I hope you'll check us out on ronbushconsulting.com. We're coming to you in a variety of ways today. If you're listening to us on the radio, you're probably either tuned in to WVLP, that's 103.1 on your FM dial, or you may be streaming us, which I encourage you to do from anywhere on the planet at wvlp.org. You're catching us on WVLP on Monday mornings from 8 to 9 a.m. That would be Central Time. Or you're catching us on Friday afternoons from 1 to 2 p.m. WVLP is an excellent community radio station. I hope you check out their website. And I also hope you get involved with them in giving back to the community. You can also find us on demand on any of the podcast platforms I'm familiar with: Spotify, Apple Podcast, Google Podcast, 6 or 7 others, or you can catch us on YouTube and the video side of things, on all under the Information Playground. We come to you on a regular basis. We're broadcast on WVLP weekly, but you can catch us on demand at any of the other outlets. Our special guest today is Dr. Rahul Gupta. He's the, I believe, executive director of the March of Dimes. I should have looked that up. I probably gave it wrong.
The Chief Medical Officer, Medical and Science, Health Officer. Yeah.
Thank you, sir. And Dr. Gupta, how can folks reach you if they have questions or they want to get more involved with what we're talking about today?
marchofdimes.org, marchofdimes.org. There's a place to send us messages as well as support us. We would look forward to you checking it out, looking at all the resources, educational material that exists there. And if you have any great ideas as well, or otherwise, just connect with us. There's so much work we do in advocacy, grassroots support across the nation. We have a presence. So wherever you might be listening, please know that we're here to support you, and we would love to work with you.
Excellent, excellent. Well, thank you, sir. You've had a great career in public health. Let's talk about that, and let's get back to the COVID-19 pandemic. Where are we first off in this pandemic? Where do you think we are? Are we on the downside? Are we midway through? Or
I think we should be cautiously optimistic. The way last, couple of months have gone on, I think we're doing a pretty good job, the best one can do to get this terrible tragedy under control. We're getting very close to about 100 million vaccinations across. We have a lot more embrace of the wearing of masks that I see across the nation. People are following recommendations to do social distancing, and they're listening. Mm-hmm. So we knew what was going to work from very beginning, all these measures. And the math is still the same. The more people get the vaccine, the quicker, the more we continue to maintain social distance, avoid big gatherings, and wear masks, the faster I think we can get to a place where we can be in the light. Now, that becomes important for a couple of reasons. First is a very simple one, which is we're just tired of it, right? It's been a year where people have been literally isolated, away from any socializing, away from their job, away from their grandchildren oftentimes, and their families and friends. So that's the first reason, that we've got to do it right, the right thing. The second reason is we have some scary mutations that are happening to this virus. We believe right now the vaccine is good enough, but it's a race against time. We've got to get more shots in the arm before these mutations spread and become something else. So it's really important. And the third thing is that to avoid more shutdowns, to avoid more lockdowns, it's important we do this, because only then can, by July 4th, can we be out there and can we start to celebrate in a way we've probably not done in a while, to get with the families, or at least we've done it, but we haven't recognized the importance of being with families on the 4th. And also demonstrate as an example to the rest of the world that America is still can be in front, because we haven't always been in front during this pandemic in terms of the pandemic. So it's an opportunity for us to lead again. So for these three reasons, I think it's very important that we do what we're supposed to right now, come home and start unifying as a nation to do our own duty, our individual duty, in order to help move us forward.
Excellent. I understand, there's always going to be people. My grandmother used to have it. I don't know why I'm getting so homespun today, but my grandmother used to have a saying about people that wouldn't be happy in any situation. She would say they'd complain if they were hung with a new rope. Well, that's kind of like let them eat cake or have your cake and eat it too, I guess is the old saying. It doesn't make a lot of sense till you really think it through. Her point was that some people just won't go along with the program no matter what. They complain about the businesses being shut down. And yet, if everyone had made a concerted effort in the beginning to wear the mask, do the hygiene, and I'm really disappointed and have been for years. I've noticed that Americans don't use the hygiene we used to do better. They used to, they probably still do teach us in school. I don't have any little children in school, so I don't know, but I'm assuming they still do. Teach general hygiene, the importance of washing your hands and using soap and doing so often. We don't do that anymore. I can't tell you how many restaurants I've walked out on over the years. When I go into the men's room and there was no soap in that dispenser or no towels, I knew the guys in the kitchen weren't washing their hands, and I don't want them fixing my food when they're not. So as a nation, we've just gotten away from things that are good for us. If we had just taken the initiative in the beginning, we could have been so much further down the road. We're not. But that doesn't mean we can't turn around and do so now. Yeah. Practice the social distancing, whether it's 3 or 6 feet. that's for other people to debate. I'm happy with any distance. The mask is the important thing, and the hygiene, the personal hygiene is the important thing.
You're right, Ron. It's interesting you talk about, our kids washing hands. We're in 21st century where if you ask a kid today, where does, carrots and peas come from? They say the refrigerator.
Right.
So it is a little bit different a time, but there was a time that you might remember that people lined up for the polio vaccine all across the street. So many hundreds of meters, if not miles, to get the shot. Mm-hmm. There was a little bit of hesitation then. There's always going to be a little bit of hesitation. Yeah. It's important to recognize the hesitation, especially when it comes to vaccine, because people are putting something that's artificially made in their body. But at the same time, look for the facts. I always say, check out the facts and don't listen to the quotes of people. Go to the source information, because I believe we have to earn the trust of the people we're serving. And that's why they need to do the homework as well and get the facts. And the facts are right now that we have quite effective 3 vaccines available. And after 80+ million Americans getting the shots, they have had a remarkable safety record so far. Yes. They are obviously, I got it, second shot for the Moderna and Pfizer. You could potentially get a little bit of flu-like syndrome. You could get a little bit of sore arm, but the vaccine does not have any virus in it, live virus in it. People have to know that. It's actually having a little symptoms is okay because it tells you the shot's working. So it's important to know the facts, know that we are fortunate to have such an effective vaccine that are available now. But we also have to do our part if we want to get out there and be able to get back to normal as early as we want. And our part, our patriotic duty now, is to get the vaccine, make sure we are able to protect ourselves, our loved ones, our family members, our workplace. And it's going to become important as time goes on. The quicker we can get back to normal, I think it's better for both our mental health, physical health, and economic health. Yes. Of the nation. So, it's important. We can always disagree on things, but let's not disagree where there's really no reason to disagree.
Right. Not disagree just to be disagreeable, which I think is unfortunately where some are. We used to be able to disagree more agreeably than we do nowadays.
Well, we never disagreed on common sense.
Yeah, that's right. That's right.
And it is common sense.
It is indeed.
Do these things. Yeah.
Where should we be going now from a public health standpoint? Where do you take us where you believe we're at and where we should go?
So we took an approach of just us initially, and then we became we're going to be a leader in the world now. And we're at a precipice of that decision now. We have the opportunity to utilize this pandemic to understand and learn the lessons. We have tremendous lessons. I mean, 100 years ago plus, we had, the influenza pandemic. And now we have this. We know and we suspect that it's not a question of if, it's a question of when the next one will come. Mm-hmm. So it's only smart for us to, as we are recovering and we are a resilient people, that we also begin to plan and prepare for the next threat. That involves making sure, on one hand, we start to invest in our public health infrastructure. Our infrastructure, just like roads and rail and other aspects and water systems, public health infrastructure has also not been invested in. In fact, we've taken money out of it for quite a long time. And it's time for us to think about that, try to figure out, well, if we needed to do tracing and tracking and testing, what kind of folks we need, what kind of resources we need, what kind of training we need. So I think it's a great time for the young students to go into public health, learn, and get into this as a profession. we also need to think about how do we prepare a workforce that is both trained in whatever they're doing, but also in response to a threat like this. This is a great wake-up call, I think, for our country. Unfortunately, we've had too many people lost to it, but it's still something we should wake up and understand that we should prepare, whether it's our business, our home, place of worship, place of work. We should be working and doing our individual bit to prepare for it. The last piece I would say is this. As I said initially, that this pandemic really unveiled the inequities, social and structural, that exist underneath in our communities. We've been alone too long, quarantined or isolated. I think we've kind of understood there's the human need to be together. But as we start to open up, hopefully, that we will also understand that there were those amongst us, really heroes, who worked through it. Some of them got infections, some of them died. And we have to ensure that we are more gracious and more giving community as a result of this pandemic. And those who can afford, do more for their community, for their society, to make sure that the next time something like this or anything close to it happens, we have everyone that's willing to chip in and do their part. So the loneliness, the separation, the mental health, the physical health aspects, I think have also taught us that at the end of the day, we are a community. We survive and we thrive because we're better than a single person by ourselves.
Well said. I think about, I've got so many different thoughts coming at me. It's hard to know which to choose. I think of the times that we've been our greatest, when we've sought to free other countries. I'm thinking of World War I and World War II. We were late to the battles, and yet we pulled together as a nation and recognized where disparities were and sought to heal those, sought to bring everyone together. This seems like very much a similar situation. There is a war. It's with a virus that we don't fully understand. We're a lot further down the road than we were a year ago, but this is all new to us. There's also, go ahead.
No, I think we'll learn something, which is, we're not going to be militaristically defeat the smallest of the organisms, right? So we know that there is a value to what they're now calling vaccine diplomacy. Once we have a certain threshold of Americans, and we certainly have a lot of volume of vaccine that we've purchased, it's going to be very important for America to show its leadership on the global front and advocate to make sure that those disparities and inequities in vaccine distributions are addressed, advocate that as much of the global population as quickly as possible gets the vaccine. We may have to call on Rotarians as an example to make sure that this work is done, because our work is not ending. We know that there will be some countries that may not get the vaccine until 2023. So it's going to be very important for us to work as a catalyst once again as a global leader and help the global community out and take that leadership space now, just like we've done in the past, right?
Well said, well said. Rotary, since they've come up a couple of times, I'll put a little plug in for them. They've been fighting polio, as you know, for the last 20, 21 years now. Continuously, Pakistan and I believe Syria always show up as the last two countries. Occasionally, some other country will show up with one or two cases. But for the most part, it's been eradicated worldwide, except for those two countries. And I think war has been the biggest problem there. They just won't let us in to immunize people. With COVID-19, I know we've promised some shots, and I've forgotten the number, to Mexico, our neighbor to the south. But there's so many other countries, as you say, that are not on the list to get. Maybe they're poor countries and they can't afford to do it, or their governments are corrupt. That doesn't mean the people have to suffer simply because they can't they can't overcome the government and their corruption. We need, if we're going to claim leadership, we need to be leaders, and we need to help.
Yeah, and it goes back to the polio example. I think what we should learn is that any conflict, any destabilizing sort of situations push back public health efforts. That's just a matter of fact, because when a particular area or government or other aspects are happening, which is destabilizing in nature, we have right now things happening in Myanmar, for example. Mm-hmm. Vaccination doesn't become the priority at the time, as we understand that. So it's important for us to be a leader to see how we can get the vaccine despite those situations into the nations, and that's where leadership is going to be critical. I was just January last year. I was at one of the Rotarian meetings in Calcutta, and we were looking at what things could be done next. This was pre-pandemic, but the ability to address social inequities, whether it's water, whether it's shelter, whether it's food, as a way to help communities across the globe. And I also had an opportunity to go visit Mother Teresa's home, one of the most unique and enlightening experiences of my life. So these are things that are going to be important for all of us, not just governments, but for individuals and citizens, global citizens, to act upon and contribute to improving.
Well said. I envy you being in Calcutta and visiting Mother Teresa's home. She's an individual I've admired for years. We're getting down to the last few minutes here. We've talked about COVID impacts on our society. We've talked about racial inequity, public health guidance. We've covered a lot of ground here, but I'd like to ask you, are there things that are on your heart, things I should have asked and I just didn't think of them, points that you'd like to get across?
I think one of the factors we're going to be dealing with is obviously the long-term impact of COVID. So we always have to look ourselves ahead, 6 months, year ahead, and then multiple years ahead. So there are going to be things that are immediately important now. There are going to be things in the intermediate and long term. And I think we can very easily see what's in front of us. But beyond that, we still have to look at the challenges and the crises that were there pre-COVID. Mm-hmm. That are still there. So whether it's the maternal infant health crisis that got exacerbated, pregnancy being a high-risk condition for COVID, whether it's the substance use disorder crisis that worsened because of multiple factors, including shut down treatment facilities, and disrupted networks, and just the evolution of the crisis itself that we've seen it worsening, or it's the fundamental issues of obesity. We know that obesity, as an example, may be playing a greater role in poor outcomes for COVID than we have perhaps recognized already. So this data will come out, but we have to make sure in the future, beyond the short term, that we have a healthy population. And we do what we can to make sure that Americans are in the best health possible, because we know that whether it's the weight, whether it's the blood pressure, heart disease, cancer, these things not only pose individual risks because of the diseases, but they also pose disproportionate increasing risk because of comorbidities they call high-risk things, so issues. So whenever a pandemic or an epidemic strikes, then people who are suffering from these challenges fare off worse because of the pre-existing conditions. So those things are important to address, but also at the same time, we have to make sure we have access to good quality, high quality healthcare. So that becomes really important and more important in post-COVID era than it was even during pre-COVID times.
You know, I recall, maybe a decade ago when electronic medical records became mandated, actually,
Mhm.
and when when that happened, when the healthcare community was forced to go into uh, special software, convert all their paper records and everything to software. A lot of physicians chose that point in time to sell their practices, many to retire if they were able to do that. And so we experienced a shortage of doctors. I don't know how acute that is today, but I know it got really serious there for a while. I think we've gotten past that. I, I know that hospitals bought up a lot of practices, but there's so much on the education. There's two things. There's the shortage of doctors and replenishing the field, the nurses. There's been a nursing shortage for years. So all of that lies at the doorstep of education, but so does our population understanding the needs and promoting that. Um, you know,
Yeah.
there's so much that in popular culture, I'm reminded of Peter Drucker's quote all the time, that culture eats strategy for breakfast. We can strategize all day long, but we've got to change people's behavior and thought patterns up to a point. And I don't mean that in a malicious way. I mean that in, you know, eating healthy. That's a choice. And it's a good choice to choose to eat healthy rather than the fatty stuff that is oversalted and processed.
Yeah.
Not alcohol consumption or drug consumption.
Yeah.
Those are choices.
Absolutely right. Absolutely right, Ron. And the what we can do as a collective society, we can make the healthy choices the right choice or the good choice, and that's where the magic comes in. If I have an urge to eat unhealthy or healthy, but there's an incentive for me to eat healthy, that's the way what we can do to start moving in that direction.
Right.
So for that, we need to move as a community together. So you're right about, the EHR part. Similarly, we have a technology world that now, of course, in the cyberspace, especially as you specialize in there, but there's an entire, we have to be thinking what is next in terms of tech. So whether it's self-driving cars or whether it's, other ways of making life a little easier, it also means that there will be people who will need to be retrained, reskilled, and re-employed in other areas. Because if not, then the hopelessness sets in, and that leads to exacerbation and worsening of, the addiction crisis, substance use disorder crisis. So it's very important. We're at the cusp of understanding and reacting to what does the 21st century data, science, tech world look like, and there are consequences for each and every one of us. And it's going to be important in this century, or in this decade, actually, I would say, for us to get it right and understand where our vulnerabilities lie, but also why it's important to have human resources, the most important capital we have. Yes. In this nation across the world. But we have to make sure we maximize the best use of it. And that doesn't mean always that we're working 80-hour weeks.
Right. Well, let's not. I'm uncomfortable now. We've entered an area. It's hard for me. So I appreciate your bringing us there. But we're almost out of time, Dr. Gupta. So no, you're right. You're exactly right. I think of our, issues like the opioid crisis. It's an epidemic. There's so much behavior that is promoted in popular culture. When I was a boy, I remember watching the old Laurel and Hardy shorts and the Abbott and Costello, and the popular comedy bits were people drunk and falling down. And we got past that for a while. We've discovered that cigarettes were bad for us, so we banned advertising of cigarette companies on television. They used to be the prime sponsors, the prime advertisers on television. And it seems like we've come back to that now. Movies, and I don't watch enough movies to know them, but The Hangover comes to mind. although there isn't advertising of cigarettes on television, it's in most of the shows, or it's in many of the shows, especially the cable shows and most of the movies, the few that I do see. We need to get back to that education and that observation that we don't do things that are bad for us. We do things that are good for us.
Exactly. And one of the ways to do that is to making good choices cool, making it the standard. Because, when we talk about our young population, it's all about fad. It's all about what's next. So there is, we have a population that's developing pretty much on the screen today, and the consequences of which we aren't even fully understanding of. So it's very important. Some of it's going to have to be intentional, where we can expose our younger generation to outside, to beyond the screen, that there is a world, and some very basic going back to the basics in so many ways. But also, I think, addressing and understanding the threats that might be upcoming up front, but making it cool to do that. So I think that I remain a lot optimistic that there are ways, because once we get our mind to it, like we did with tobacco and other areas, we are able to make very significant progress. And one of the things we learned out of it is, especially for youth and children, it's making it the easy choice, the fun choice, the cool choice, the right choice.
Excellent. Well, that's an excellent point, and it's an excellent point to end the program on. I want to thank you for being on. It's been a pleasure getting to know you and introduce you to our Information Playground audience. I'll give you the last word in a moment. Let me just do a last identification of how folks can find us. I'm Ron Bush. You can find me at ronbushconsulting.com. Send me an email, ron@ronbushconsulting.com. I do like to keep things simple where I can. You can catch us on Monday mornings from 8 to 9 and Friday afternoons from 1 to 2 on WVLP. That's WVLP.org. If you stream us or go to the website, it's 103.1 FM if you're fortunate and live in Valparaiso, Indiana. You can catch us on most of the podcast platforms as well as YouTube under The Information Playground. Dr. Gupta, it's been a joy with you today. How can folks reach out to you? How can they contact you?
Well, marchofdimes.org or marchofdimes.org is the best way to visit us, meet with us, learn what we do, and support us. We love to hear from you. We hope that you have enjoyed our discussion today. And Ron, I thank you for your indulgence in discussing some of the most compelling and important issues that relate to public health across the nation.
Been my pleasure and privilege, Doctor. Thank you. Have a great day, everyone.